I'm here with Dr. Larry Brock. Larry Brock is a doctor that I admire because he's one of a consortium of doctors who are aligned with foreverhealth.com. What is foreverhealth.com? It's a network of physicians that understand that the planet has changed, that we are severely affected by the environment, about the change in our food supply and what it's been doing to our body. These are all things that were not taught in medical school because the conditions didn't really exist at that time. So doctors such as Dr. Larry Brock had to go back and relearn, and that is so admirable. I can't imagine going all through medical school and then going back to school because I was never a very good student. Hello, Dr. Brock. How are you?
I'm doing fine. How about you?
Just great. You know, we're going to talk today about the thyroid and how it affects weight loss and weight maintenance, because I find with women who write to me, they all say the same thing. I don't eat, I work out, I'm gaining weight, I'm not seeing any response to my workout. Is this mainly a thyroid issue?
It is mainly a thyroid issue, but it's partly a cortisol issue. And what we do, we measure most all the hormones, and we use Dr. David Zava. And you're familiar with David Zava. He's
yes.
In Beaverton, Washington. We use his ZRT primarily, and we measure estradiol, progesterone, the ratio, testosterone, DHEA, all four cortisols, and we do a thyroid panel. We measure TSH, T4, T3, and TPO.
Okay, so for the sake of the viewer who probably aren't familiar with TSH, T3, and T4, tell them why they should care about that and what those initials mean.
Well, TSH is thyroid stimulating hormone, and it's really a pituitary hormone where it comes from. It goes to your thyroid, and your thyroid makes mainly T4, but it makes a little T3. And it goes to your liver and kidneys and turns into T3. And T3 is your active ingredient. Now, it can be a situation, and about 80% of the time it's women instead of men, that have Hashimoto's thyroiditis. And that usually is antibodies related to the thyroid, and it causes the thyroid to go down. And when the thyroid goes down, your belly fat gets up.
See, now we're coming to what the problem is. When the thyroid goes down, how does that manifest? How does that person feel with, we're talking about a hypo. There's hypothyroid and hyperthyroid.
Right.
The speeded up one is hyperthyroid and the slow one is hypo. So when I have low thyroid, how am I feeling?
Well, usually you feel fatigued. You don't feel as good as normal as you did when you were in the teens or 20s or 30s. And you feel like you're feeling a little bit old. And you gain a little bit of weight, and you go to the gym and you exercise. Well, you can't out-exercise your mouth. And you become carbohydrate dependent when you have thyroid low. And what happens is you begin to worry about it. You begin to have sleepless nights. Cortisol makes you gain weight. Low thyroid makes you gain weight. And what happens is you go to the gym to work out, and you don't have the response that you normally have. And that is, you usually have contour and tone and a lot of things that decrease the size of your waist. Well, you lost.
Yes, you go on. I'm sorry.
Well, what happens is you lose your progesterone at age 21, 22, 23. And by the time you're 35 or 45, you sort of hit perimenopausal situation. And when we as doctors just made up menopause, we made up menopause to say that that's 12 months of not having a period. So you can have a surgical menopause at any age, or you may have menopause naturally And it usually occurs at somewhere around 50, 55, 56.
So you just mentioned something interesting about a surgical menopause. That would be, if I can give you a little of my own history of, I wish I had understood the impact of low or no progesterone, because I was one of the many women who suddenly I'm bleeding uncontrollably, and also I am diagnosed with breast cancer. But it seems to me, and maybe you can correct this for me, this isn't just me connecting dots, that if estrogen is carcinogenic, but progesterone is anti-carcinogenic, then when you lose your ability to make progesterone, you are over-making estrogen, becoming estrogen dominant, and that's a dangerous scenario, right?
Right.
So then you put back so if one hormone's off,
we put back the progesterone.
Correct.
But a lot of people, particularly OB/GYN, do not put back progesterone. They put in a progestin, which blocks some actions of progesterone.
See, this is what I was saying about why it's so necessary for doctors such as yourself to go back to understand this, because so many women say, oh, I'm on progestin. Explain why that's not the right molecule for your body.
Well, it's not the right molecule by what I said. It blocks some of the actions of progesterone. Mm-hmm. But you don't have estrogen in your body. Horses do. So we started...
We're talking synthetic, right?
Synthetic.
Okay.
So we started giving Premarin and Prempro, and the doctor said, well, what about progesterone? So they named methylpredroxy progesterone acetate. It sounds like, oh, it has progesterone in it. It doesn't have progesterone. That's a progestin that blocks some of the actions of progesterone.
And so many, I know that's a $20 billion a year business, and yet bioidentical hormones, there's never been a reported case of cancer that I'm aware of. Maybe you can confirm that, of cancer on people who are taking bioidentical hormones. Why would that be?
Well, I agree with that is biologically identical to what your body makes.
Right.
So God didn't give you anything that gave you cancer.
Right.
You
right.
take away certain things.
Right.
That causes cancer.
Right.
And that's where you take away progesterone, you have too much estrogen. You have too much estradiol when you take away progesterone. And you rob Peter progesterone to make more cortisol. And the more cortisol you have, the more cancer you'll have. And
also, high cortisol is why women complain of their inability to sleep, correct?
Correct.
Yeah. So how do we get our cortisol down? Because it seems to me if you get the cortisol down, then the insulin will go down and the thyroid and the adrenals, right?
Right. Well, you get the cortisol down and it goes up as you get older in age, and there's different ways, as you know, to measure somebody's age, whether they're born and what's on their driver's license. That's their calendar age. That's their chronologic age. Mm-hmm. How old would you be if you didn't know how old you were?
Oh, isn't that Satchel Paige, the first Black Baseball Hall of Famer, said that? How old would you be if you didn't know how old you were? And that is true. It's no longer about the number. It's about your energy and vitality. Will a person who goes on bioidentical hormones, can they expect to have renewed vigor and vitality and libido?
They can expect it if they get everything correct. That is, they have to get the hormones, and we deal with just hormones. You have to get your micronutrients to make your hormones work. And you have to get your hormones working to make your neurotransmitters work properly. And your neurotransmitters are things usually made by your adrenal gland. And we have no one test that will measure adrenal function. We have no one test.
Right.
We don't have a blood test to tell whether you're living or dying or dead. We have electrical tests. And we all know them. We have the heart, EKG. We have the EEG, electroencephalogram for the brain. And when you flatline, you flatline.
Now, when someone comes in, yeah, dead is dead. When someone comes into your office, is it true that doctors are taught to assess within the first 5 minutes just by looking at the patient what's going on with that person?
Well, we're taught that, but that's not true.
Okay.
You can't look at somebody and tell what their brain is doing. You can't look at something like Danny Amen, he might can, or you can't look at somebody and tell whether they have a good heart or not.
What about thyroid symptoms? Do you look at their eyebrows?
Well, you look at their lateral third of the eyebrows, the outer third, and you look and see whether or not they've lost it. That's Queen sign. It's Hertog sign. And you look at whether or not their hair is falling out. It could be stress. It could be thyroid. Or it could be both.
By the time a patient has found you with your specialty, I imagine they've been to a lot of other doctors trying to get an answer. What made you want to be this kind of doctor?
Well, I used to do a lot of thyroid surgery, and I thought that some people knew what they were talking about. And what would happen was you would send the patient back to whoever referred it to you. Then I got to figuring out that they didn't know that much about thyroid. They didn't know that much about women. They knew technically how to do things. OBGYN did. And I'm the one that said for years and years and years that you should never say OB-GYN in the same breath. Like you shouldn't say eye, ear, nose, and throat in the same breath. You shouldn't do it. Because they know technically how to operate on somebody, but they don't know enough about women. And I'm not sure anybody does know enough about women.
Even women.
Yeah.
Isn't that the definition of a eunuch? They know how it's done. They just can't do it themselves.
Maybe. Yes.
Now, why is the thyroid so important?
Well, the thyroid's important, and we knew way back in the biblical times, in the New Testament and the Old Testament, that thyroid was important. And we didn't know thyroid back in those days. We call it a shield. And we treated thyroid problems, Gorders, which is a swelling of your thyroid, by burned seaweed. But we lost the art. We lost it. And we lost it for many, many, many years. And so we didn't know how to treat thyroid. But we knew something was controlling what our metabolism was. Something was. And it was thyroid, mostly thyroid. And it could be a lot of other things it could be, but thyroid was important. And so I operated on thyroids, and I'm a recovering surgeon. And I wished I would have known more about thyroids at that time. I did not know much about thyroid. So as you mentioned, you had to go back and learn something about thyroid. And we only knew Synthroid, which is over 100 years old, which only has T4 in it. It has to be converted to T3 or it's no good. And if you take 100 people and arbitrarily take them off of Synthroid, and you put them on something that has T3 and T4 in it, Synthroid just has T4.
Like Nature Throid?
Or Nature Throid or Armor Thyroid or whatever that has T3, T4 in it, about 85% of them will get better. And so you ask them one question: are they better or worse? And 85% of them will say better. 15% will say, can't feel much difference, might feel a little worse.
And when they feel a little worse, do you up the dose?
Well, in Synthroid, you up the dose. And some of the things that we do, we may change their medication, and it may make them better, or we may have to change their sleep patterns, and we may have to change the way they go to the gym. We may have to change the way they're eating, the way they stressed, de-stressed, and we look at lifestyle.
As in, are they eating the good stuff or crap? Or?
It's not how much you eat, it's what you
Right.
eat, when you eat, and it has a lot to do with your eating habits. And we, as I mentioned earlier, that we get a lot more carbohydrate dependent and sensitive because we have more cortisol and we have less thyroid medication.
So, to get the cortisol down, do you give hydrocortisone replacement?
Well, to get the cortisol up, we do. To get the cortisol down, we try to get people to do things that de-stress them. They walk slowly and they take a walk, and then it'd be better if they would, and we don't have it in Mobile, but you have it some places where you walk in nature and it improves them.
Right.
Now, what we use is something natural, rhodiola, 250 milligrams at night. And sometimes we use it in the mornings, but we usually use it at night to try to keep their cortisol down and to make them sleep better and increase their melatonin. And melatonin, as you know, that it likes cancer.
Yeah.
It kills cancer.
Right. The women, the biggest killer of women is heart disease, heart attacks, strokes, etc. Chronic high cortisol, from the books that I've written, leads to heart attack, strokes. So it seems to me that working with you and getting the cortisol down and working on getting the thyroid normalized is pretty important for quality of life, right?
It is, and if you don't get the cortisol down and you don't get the thyroid most of the time up, you're not going to get anywhere with your other hormones and your other micronutrients and your neurotransmitters.
That's an important thing for people to understand. I know I take 1.5 grains of thyroid daily. If I forget, which I rarely do, I all of a sudden will find myself, as I describe, dog tired. And when I feel that feeling of, I feel dog tired today, which is not a natural feeling for me, I realize, I forgot my thyroid. So it really does affect vitality.
Oh, it does. It affects the way your sugar gives you energy, and it affects the way that you have energy. And it's a whole different, it's another talk in itself.
Right.
You can spend weeks and weeks on energy. And thyroid is not the only thing that gives you energy, but if you don't get your thyroid corrected, you're not going to have the energy that you want.
So what is it that throws it all off? Is it when you first start depleting in the minor hormones, estrogen, progesterone, testosterone? Is that where it starts and that raises the cortisol, the insulin, thyroid, adrenal? Is that how you see it?
Well, that's pretty much how we see it. There's no major and no minor hormones. The major hormone is one you don't have. The minor is the one you do have. So,
I've always heard that estrogen, progesterone, testosterone are minor hormones, and I thought to myself, I don't know why they call them minor, because when you're missing one or any of those, it's not minor. It's life-changing.
it's major.
Yeah.
So you really can't divide hormones into major and minor. We like to do that, good and bad, black and white, all kinds of things that we divide it and humanly divide up things. But there's no major hormones. There's no minor hormones. Everything is major.
If I'm a patient and I came to you and I said, I can't sleep, I have no sex drive, I'm gaining weight, I'm bloated, I'm constipated, I'm in a bad mood all the time, where would you start?
Well, we start by asking you why you came to us in the first place. And we have 4 blanks, and 3 out of 4 blanks will be they gained too much weight, they don't have enough energy, they don't have enough sex, and something vague. Over and over and over. Now, we also, you fill in, you can say anything you want to, and we have 20 or 30 pages of things that you can ask and answer. And we ask different ways of the same question, but we ask different ways because we want to see if you tell the truth. More than likely, we'll tell the truth.
No, a patient would never lie, would they?
Well, they don't have any reason. They don't have any reason to lie to me because I don't do anything that lying, like workman's comp and things of that.
Right.
I don't.
I think in that question, how many alcoholic drinks do you have in a week? That's probably the biggest place people lie. If they say twice, what do you think it really is?
It's probably 4 times. It's usually twice what they say.
Is this an enjoyable specialty for you now that you're a recovering surgeon and you've gone into this line of work?
I wished I had known what I know now about 20 or 30 years ago. But and I have a lot of patients that are heads of departments and presidents of colleges and medical schools as patients. They come, they say, we want to teach this kind of medicine. Well, they don't have anybody to teach it because they hadn't learned it.
Right. And
they don't have the patients anyway. I have a very skewed population. I know that. I treat just intelligent people, and they from all walks of life. They're all intelligent.
Well, I think by the time they find a doctor such as yourself, you've had to do some research, whether it's just soul searching or reading books or whatever, to realize that there is another way now. And it is so life-changing. Don't you agree?
I agree. And we should have known about hormones 40, 50 years ago.
Yes.
And we didn't know. And we're still getting false information from the state and from the federal government, false information, because we don't want to get into that because tomorrow is election day, as you know. It'll be pretty soon.
You want to talk after?
And the government wants you, if you live in America, they want you to die off by the time you're 65.
Yeah. Yeah. I know I did have a friend in Canada, a great girlfriend. And at 75, she needed a lung transplant, and they said, you're too old. So I think what you are doing relative to anything that in that arena is practicing prevention, right?
Well, yes, that's so true. And in Alabama, and I practice in Alabama, I practice in Mobile. In Alabama, they ran all the preventive people out of Alabama, out of the state. And they ran them out because they wouldn't pay them. They didn't pay for prevention. They only paid for intervention. And they still pay for intervention. they don't tell you, as cardiologists, how to avoid a heart attack. And we do. We have any tool that we want. And roughly there around 300 or 400 different types of tools. And the cardiologists have only 3 or 4 tools at their hands,
right.
And they only get paid for intervention. They don't get paid for prevention.
Well, I find that those of you who have gone into this arena courageous and the real pioneers, because there is certainly a new way to age, and it's diametrically opposed to the present paradigm of aging, which is something that we look at as something we fear. It's decrepit, it's frail, it's one of the big 3, Alzheimer's, heart disease, cancer, ending up in a nursing home. And my feeling is that doesn't have to be our end point, that if we practice this kind of medicine that you are espousing, to put back what nature has depleted, you can live the way and end your life the way our grandparents did. Remember, they used to die in their sleep, and it was not a long, drawn-out, expensive death. So it must be very rewarding to do the kind of work that you're doing because you see the biggest picture.
Well, it is rewarding, but it's uphill, and you have to go uphill all the way, and you have to enjoy going uphill. Because people tell you, oh, well, you used to be a good doctor. What does it mean? You used to be a good doctor.
Yeah.
Oh, wow. You jumped out of the box.
Yeah. Yeah, I did. But that to say somebody, you used to be a good doctor, that's certainly not the category that I would put you in. We are now down to, we've just got a couple of minutes left. And I'd like you, for anybody watching this who has not been exposed to bioidentical hormones, who doesn't feel good, what do you have to say to them?
Well, I say to them, lifestyle, lifestyle, lifestyle. And it's not always their fault. It's not always the male or female's fault. They've lost their hormones. They can't get them back. And so they come to me and they get them back and they feel much better. And
then you have happy patients.
Well, I have all happy patients. It's wonderful to come to work every day. You like every day.
They say if you do what you love, you'll never work a day in your life.
Right.
You have great warmth, and I admire that you've stepped out of the standard of care box to treat your patients this way. And for any of you who are watching this interview with Dr. Larry Brock, go to foreverhealth.com and find a doctor nearest you. And maybe if you live in Alabama, you'll be able to get an appointment with this wonderful man here. Thank you so much.
Thank you.
Okay, I enjoyed it.
I enjoyed it.
Okay, bye-bye.
Bye-bye.